too. My next guest, I'm excited about bringing him on because a lot of people just might need this, and you never know, especially if you've been in an accident. I have with me Marcia Dufern, and she is the owner of Personal Injury Clinic. You also have with you your medical director, and that's Drew Hunter, MD. Welcome to the show.
Thank you.
I want you to talk to us a little bit about your background, a little tiny bit, and also about the clinic. It's really important they hear that. And today what you really wanted to focus on was kind of about what people should do after an accident.
Sure. So I'm a medical doctor. I graduated medical school, and following that I did a year of surgical internship and then a year of physical medicine rehabilitation residency. Following that, I did 4 years of radiology residency and another year of vascular and interventional radiology. So I have a very broad background. Currently, I'm medical director of personal injury clinics, and really our whole goal is to, when people are involved in accidents or slips and falls or work-related injuries, they really don't know what to do. So many people are confused, or, oh, they think they're fine. I mean, number one is make sure you're okay. You know, get to the hospital, get checked by a paramedic, whatever you need to do. Safety is the number one concern. Following that, people don't know what to do. I mean, should they call an attorney? Should they, you know, what do we do? So we're a personal injury clinic. So we are more of medical providers to manage the case. And our whole goal is to basically, we want to get you back to your old life prior to the accident. And you may not feel it right away. The next day you may wake up with horrible pain and you just don't know what to do. So we're available. You come in, we do an evaluation. We basically medically manage the case. We work with many other providers. We work with all the attorneys in town. We refer out for imaging, for specialists. We want to make sure that we guide you through the process. And it's intimidating.
I like the way that you put this before you came on. You kind of like said that you're their quarterback.
Yes.
As you, and they'll get up on the mic so we can hear you. And what you mean by that, and because, and also when we talked a little bit about the calling, who to call first, obviously to take care of yourself first, make sure you call an ambulance. And obviously a lot of people think, oh, well, I got to call my attorney. But you said no. You said not necessarily, Carol, and go ahead.
Well, some people may have an attorney they've worked with in the past, so that's a great option. But a lot of them don't even know who to call to begin with. So that's where we can help them, kind of guide them into some attorneys that we work with currently that are great, and we have a solid track record. So, we could be the first step. Give us a call, and Dr. Hunter will treat them with our other providers, and then definitely hook them up with an attorney.
I got to ask you this for a second right now. So is there a statute of limitation? I'm going to use those words there. Let's say somebody's listening to this and got into an accident, let's say maybe a week, 2 weeks, a month ago, I don't know how long. Are there statutes of limitations?
There is, as far as, usually it's up to 2 years, and then at that point they can extension, attorneys will file an extension on that.
Mm-hmm.
But, honestly, if you're really hurt, more or less you're going to go see somebody, right? And so that's kind of important with your case, because those insurance adjusters looking at that case, they want to make sure that, if they're really hurt, that they've actually gone and get that treatment immediately and not just waited 2-3 weeks. Because then how hurt are you, right?
And I had asked you before you came on, people think that they might need a referral. They don't necessarily.
Not to come to us, no.
No, and I'm going to say this. I sometimes say this with DUI attorneys, right, when they're on, and put this number in your phone. I think this number should be in people's phones.
Thank you.
The reason why I say that is I'm sitting here thinking to myself, first of all, that can happen anytime. We always know somebody who might have been in one. So you write the number down. It's 602-688 6884. Your website is what?
It is
Personal Injury. Okay, here we go. Personal Injury Clinic, phx.com. You can go up there and you can check them out as well right there. Okay, so let's say they've been in an accident either on the job or in a car accident. How do they show up to their office now? What do they do? Limping with crutches. No, I'm saying. Go ahead.
Just simply call. We try to get them in as soon as possible, usually within a day or two, immediately. And we just want to try and make sure that their injuries are not life-threatening. Make sure that it's something that we can help manage them. And a lot of times people they just don't know, so we want to guide them through the process. We connect them with other providers such as physical therapists or chiropractors or whoever they need. If they need neurologists, imaging, additional MRI imaging, we have We work with all the different imaging centers in town.
So what does it look like when they come into the office? Now they've gotten into your office, they're sitting there. What's the process? Because you said that you also take care of them as well.
Sure. So we provide medication at that time with the visit if they need it. We
Yeah.
do good.
It's really just more of like, okay, so these are your issues. We want to try and let's tackle them, right? Let's get in there. Let's try and get you on the road to recovery. We're going to get you to see these people. You know, sometimes people already have providers they've already seen. You know, we work with them as well. You know, we just try to keep in contact, good communication with them. Our whole goal is to just see a steady progress in moving forward.
Yeah. So, and we want this acute pain to stay acute, not turn chronic pain, right? So, Dr. Hunter is an interventional radiologist, which means we actually do the procedures in our clinic.
I was just going to ask
Right.
what the difference between that is. Go ahead.
I'll let you talk about that.
So, you know, a lot of times people, the way I like to treat interventional pain management is, you know, we try to stay away from narcotics. You know, we want, because a lot of times, I mean, it's an addictive thing, and we don't want to create more problems for the patient. We want to help them with acute pain. First, we treat them. We want to get them as best as we can be. Sometimes people need an additional over-the-hump kind of thing to get them going, you know. So they may need trigger point injections, they may need medications, they may need like physical therapy, chiropractic, they need epidural injections. And these are meant to really just assist the patient in getting over these little humps to try and get on a more steady progress, to try to avoid surgery. You know, we want to try and get them on a steady road to recovery to get them back to where they were pre-injury.
Their phone number, it is 602-688-6884. The website is personalinjuryclinicphx.com. You can go there, up there, and see all the information about the clinic and how they work. More importantly is, I always say this, maybe it's you, maybe it's someone that you know who has been in an accident and they're not getting the help they need. And also the education. I think that's another part that you help people when you say that you do that quarterbacking, is you're educating them on how, and I want to say this too, there's some people when you say they don't know what to do, some people realize that they have the right to also all of this too. Can we talk about that for a second?
So a lot of times people think, oh, well, you know, I just have to do what my insurance company says. I mean, and that's why they have attorneys. Attorneys fight for them. I mean, attorneys are great. I mean, they can really help you because a lot of people suffer. And if you're not treated properly after the accident, I can't tell you how many people say, I've never been the same since the accident. And I say, well, were you treated properly? They're like, well, no, I just thought I'd get better. And, you know, and that's why your attorneys are to help you.
Well, let's talk about a particular case you might have that you want to share with us when it comes to interventional pain management.
So usually a patient is being treated, you know, initially comes in, they get in a car accident, unfortunately, or slip and fall, work-related injury. They're being treated, and they're seeing us as medical management, a chiropractor or physical therapist, massage therapist, whoever. And after about a month or two, they're just not getting that. I mean, they're getting a little better, but they're just not really progressing like we want them to. You know, we may order imaging, MRIs, and see what's really going on. If there's something going on, I can have a consult with them, talk with them, discuss the options. I could do a small exam. You know, I can give them what I believe is going to be the best for them. I mean, I just really want to treat people like I want them to treat me.
Sure.
You know?
Now, this is a big question. Okay, who pays for the treatment?
That's a great question. So, you know, well, I'll let you if you want to.
So we work with the attorneys, we work with the insurance companies, we work with on lien, so they don't have to come in and say, oh, I have to write a check. No, you don't. Mm-hmm. You know, we want to try and get you the best quality care that we can, and that's our whole goal. You know, and we work with the attorneys and everybody.
And you have attorneys that you
Right.
work with. I want to talk about that part
We
of
do,
it.
yeah. So, I mean, going back to that lien part, I mean, we really get paid after the case is settled, pretty much. So, but as far as attorneys we work with, you know, like to say there's there's maybe reputation out there for personal injury attorneys or these ambulance chasers. You know, that's not really fair because these people are actually excellent at what they do. They have,
Right.
you know,
That's
they
their specialty.
really, that's their
Yeah.
specialty, right? So we try to work with the best. We work with many attorneys in Newtown, right? But there's definitely some that stand out from the others
Right.
that we're proud to work with.
Well, and if you don't have an attorney, they can help with that as
Right.
well. That's what they mean by quarterbacking with
Yes.
you to help you get what you deserve. Number one, if you've gotten hurt, everyone deserves to be taken care of in that way. But making sure that you are no longer in pain, and that's
Correct.
a big one as well. Where are your offices located?
So our main office is also where our procedure room is right on 20th Avenue in Camelback, basically just a quarter mile from I-17. And then we have several offices throughout the valley. On the east side, west side, we have 6 satellite offices currently. And we're open 5 days a week, and we also do home visits if necessary.
Wow. So you can check all that information out on their website. The phone number to call them direct, it's put it in the phone, guys. You just never know when you need it. 602-688-6884. The website is Personal Injury Clinic, phx.com. What are your final words, real quick?
I just want to say that, if you get injured, really take care of yourself.
Take care of
You'll
yourself.
suffer for a long time. If
Right.
You don't.
And we all know that because a lot of us older folks here that have been through it, we know exactly what you mean. So again, here's something that is so important for people out there. Make sure that you do take care of yourself first. Give them the call. They're going to help you throughout the entire ordeal, whether you need maybe an attorney or not, they can help you with that as well. 602-688-6884.